we're going to be talking about synovial joints. They're the most common, most movable types of joints in the body. Synovial joints are diarthrotic joints that have a fluid-filled joint cavity known as a synovial cavity. The fluid is contained in a fibrous capsule. The main function of a synovial joint is to provide movement and stability to the body. There are 6 types of synovial joints. We'll start off with a pivot joint. Basically, it's rotation. So you can find that in the atlas and axis bones, C1 and C2. You can also find that in the proximal radial ulnar joint. It allows rotation along a longitudinal axis, like a swivel. So C1 and C2 allows me to do this movement. The next joint we're going to talk about is a hinge joint. This one you can find in the elbows, knees, fingers, ankles, and toes. It only allows movement in one direction. And an example of that would be flexion and extension of the elbow. So flexion, extension of that elbow. Then we've got the gliding joint. The gliding is located where bones meet on a flat or slightly curved articular surface. This allows movement in that direction along that plane. So for example, on the wrist, you've got this movement or this movement along that axis, that plane. Next up, we've got the condylar joints, biaxial joints, allowing for 2 planes of movement. That will allow you to do flexion, extension, adduction, abduction, or circumduction. It allows basically all the movements except axial. And that one you can find in the wrist, metacarpal joints, and in the digits 2 to 5. Next up after that, we've got the saddle joint, which is basically what it sounds like. It's a bone that looks like a saddle, and it's got another bone that acts like a person that's sitting on that saddle. That particular one allows for all the movement as well except the axial. You can find that, an example of that would be in your thumb. Last but not least, we have the ball and socket joint. You can find that one in your shoulders. You can also find it in your hips. That allows for any kind of movement. So you've got your flexion, your extension, your adduction, your abduction, your internal and external rotation. And it's just like it sounds like. It's a ball that sits in a socket, is what that is. So what do you do if a patient is limited in range of motion and let's say you're trying to do an AP elbow? What you can do is just find an alternative trauma view. An example of that would be the condyles view for the elbow. So you would continue to keep your patient as you would in a lateral view. Make sure that the arm is flat. You'd still have to have your thumb towards the ceiling. And you would just point your beam 45 degrees towards your humerus. And then that way you would be able to see if there was a fracture there. So you just kind of have to maybe just read a little bit about it or try to help those patients out that might have a trauma or a fracture they just can't move. Some other movements that you always are going to use being an x-ray technician would be supination. So we'll go over that. That's going to be your hand up. And then we're going to go over pronation, which would be hand down. I'm going to slightly turn it a little bit so you could see a little bit better on the camera. You would do this, for example, when you're doing a PA of a hand and you have your abduction, which could be shown like this, fingers out. And the adduction would be fingers in, close to your body. You've got the rotation, where I could show you on the elbow. So I'm rotating my arm medially and then I'm rotating it out laterally. This is an example of, let's say you're doing an internal picture of a shoulder and then you want to do an external. You would have them do that kind of movement. Moving on, you've got your circumduction, and that just basically means you're rotating your arm. You've got the depression, and perfect example of that would be the shoulders. So you just kind of bring your shoulders down. Sometimes people are in pain and they kind of hold their shoulders up. You could just ask them to bring them down. An example of that would be if you're trying to get a good lateral view of the C-spine and they have their shoulders up and you can't see C7, you would ask them to relax their shoulders so they can depress them. Next up, we're gonna go over again the flexion that we talked about previously, and we also talked about the extension. Lastly, I don't know if I can get my ankles up that high, but I'm gonna show you as if my hand was my ankle. So let's pretend my hand is my ankle since I don't have a model here, and I apologize for that. But this would be the inversion. So you would turn your foot in. Eversion would be your ankle out, your foot out. You've got your plantar flexion, which you would do your toes down to the floor. And lastly, you could do the dorsiflexion, which your toes would go up towards your head. And that's all we've got today. Hope you enjoyed.